Good afternoon. My name is Elaine. I'm a registered nurse and a student at Aspen University BSN program. I'm here to complete a head-to-toe assessment. This is my patient, Morgan C. I'm going to ask her all her vital information, which I have already verified, utilizing her state-issued identification. Morgan, do you give permission to participate as a model in this assessment assignment and be recorded for school purposes for Aspen University Class N495?
Yes.
This assessment is indented to show my skills with the assessment actions only and is not to be used as direction for your health status or follow up with any irregular findings. Do you understand this?
Yes.
Can you give me your name, please?
Morgan C.
Can you give me today's date?
It's July 20th, 2019.
Can you tell me what your age is?
29.
And your date of birth?
March 5th, 1990.
I'm going to begin taking Morgan's vital signs. First of all, her temperature. Her temperature is currently 97.5, and I will be documenting all vitals as I take them. I'm going to take her pulse now. Her pulse is currently 80 beats per minute. How are you feeling today, Morgan?
I'm good.
That's good to hear. In this hot weather, are you drinking enough fluids?
Yes.
That's good to hear. I'm going to take a 2-step blood pressure on you. Is that all right?
Yes.
Just relax. Just relax. There you go. Morgan's blood pressure at this time with step 1 is 122/62. I'm to wait 30 seconds before attempting to do another blood pressure. Currently, today's temperature is 100 degrees, and it's very humid. I apologize for my sweating. Just relax. The second step was 120/64. So it is within range of each other. Morgan, are you in any pain at this time?
No.
That's good to hear. I'm glad. I have been observing Morgan's respirations, and at this time I've noticed visually that she has 18 per minute respirations. Previous to our start of the assessment, I did wash my hands in front of Morgan. Is this true?
Yes.
I'm currently going to don my gloves as I will be touching Morgan. Will that be okay?
Yes.
Again, my name is Elaine, and I'm a registered nurse. And you know where you're at.
Yes.
What state?
New Jersey.
Very good. Morgan's level of consciousness is awake, alert, and oriented times 4. She is aware of where she is, who she is, why we're here, and the year. I'm going to inspect the structures of Morgan's head at this time, her face and her neck. I'm going to touch you now. Her face is symmetrical. Her eyes are equally distanced. I'm going to inspect the structures of her head, face, and neck. Her arteries, the carotid, and the temporal. Just relax. Very good. They are a +2 at this time. Both left and right. Both carotid and temporal are +2 at this time. I'm going to palpate Morgan's jaw for symptoms of TMJ, which is temporal mandibular joint disorders. Can you open your mouth? Close your mouth. Open your mouth. Close your mouth. There is no clicking or joint dislodging at this time. And now I'm going to palpate for enlargement of thyroid, both at the outside of the trachea Can you swallow, please? Can you swallow again, please? And one more time, please. Thank you. All are within normal limits. I see that Morgan, can you swallow again, please? Her trachea is midline. Morgan, can you please clench your jaw? And release. And clench your jaw. And release. That's for assessment of facial sensation, the trigeminal nerve. Morgan, again, has facial symmetry at least 4 assessments. Can you raise your eyebrows, please, Morgan? And close your eyes. Close them tight. Can you smile? Can you frown? Very good. Morgan's facial nerves are within normal limits at this time. Morgan, I'm going to assess your speech quality. This is to test cranial nerve 12, the hypoglossal.
Oh no, I'm going to get it backwards.
Can you please repeat? Light, tight, dynamite.
Light, tight, dynamite.
Can you repeat that again?
Light, tight dynamite.
Very good. This is all within normal limits. I'm going to palpate for Morgan's cervical lymphatics, the posterior auricular, the occipital, the retropharyngeal, the submandibular, the submental, sublingual, superior superficial, cervical, posterior superficial, cervical, and supraclavicular at this time. No lymph nodes are found at this time.
I can snap you like a chicken.
I couldn't help it.
I'm sorry, doctor. Luckily, she is my daughter. I'm going to inspect and palpate her skin, and I'm going to take note of her color, moisture, and temperature. Again, her temperature is 97.5. She is warm to the touch. Test for Turgor. And it snaps back immediately. There is no tenting. She is not overly moist
Anymore.
I hope my instructor appreciates your sense of humor, my darling. Skin turgor is intact. Capillary refill. Oh, lovely. Is less than 2 seconds. I'm going to test for edema and check for edema on her lower extremities. Morgan has no edema at this time. Morgan, I'm going to test your cardinal vision. I would like you to follow this pen. Follow my pen. Don't let it leave your sight. Again, we're going to have to repeat that. I apologize, Dr. Metcalf. One more time. Follow the pen. Very good. So she has accommodation. We're going to check her corneal light reflex.
Bright light!
The quote, twinkle in her eye, rests on the exact spot on each pupil. Morgan, can you please look at me? Look at my nose and don't waver. Morgan's eyes are equal round and reactive to light. I am now going to check her ears. Morgan was able to supply me with an otoscope. Both of Morgan's eardrums are intact and opaque. I'm now going to assess Morgan's nose, mouth, and throat. Can you look at me, please, Morgan? As I said earlier in the assessment, Morgan's face is symmetrical. Her eyes are evenly spaced. I need you to tell me if you feel any pain. I'm going to check her sinuses. You feel any pain or discomfort?
No.
Any pain or discomfort?
Nope.
Can you close your mouth, please? And can you open your mouth? Can you say ah? Say ah.
Gotta be a difficult patient for you.
Morgan has no complaints of any maxillary or frontal sinus tenderness at this time. Her external nasal structures are patent, although she does have observed piercings in place that are not causing her any pain at this time. Her nasal structures are patent and symmetrical in appearance. Her oral cavity is moist, pink. Her tongue is slightly coated due to smoking. Her teeth are intact at this time. There are no lesions noted. And her uvula moves when she says ah. Yeah, you'd like the uvula. I'm now going to assess Morgan's breathing. I need you to sit up, Morgan. Thank you. Okay, breathe. And deep breath. And again. Are you comfortable so far?
Yes.
Deep breath. Deep breath. I'm going to pull your shirt up a little bit. Deep breath. And deep breath. At this time, Morgan's lungs are clear and auscultate beautifully. There are no crackles, bronchi, or wheezes noted at this time. Okay, I'm going to auscultate your carotid artery. And you hear an observed whoosh. There's no abnormal sounds at this time. I am now going to check Morgan's heart sounds. I need you to put your hands down, please. Her aortic is noted to be of sound. Pulmonary is audible. Tricuspid. And I will check Erb's point. And now I'm going to do that with the bill. There are no abnormal findings at this time. The heart is strong and audible. I'm going to inspect your joints, make a fist, lower. Is there any pain at this time?
No.
Raise your hand. And your other hand. And down, bend, and up. Any pain? Any clicking?
No.
Okay, you could go ahead and lower your hand. Can you raise your arms, please? And lower. No pain?
No.
Okay, that's wonderful. Okay, can you face me, please? Can you grab my hands? And squeeze. And release. And squeeze. And release. And can you straighten your leg out? And bend. Can you lift up your foot? And lower your foot. Very good. All within normal range of motion. Can you stand, please, Morgan? And can you put your hands out to the front? And hold it there. There is no drifting. Morgan, can you close your eyes now, please? And keep your arms out to the front. Again, there is no drifting. Thank you, Morgan. Okay, Morgan, can you take a few steps towards the camera, please? Heel toe, again, and turn around, and make a few steps forward. Thank you. I'm going to test Morgan's reflexes at this time. One on her upper extremity. I'm going to do her tricep. How I find her tricep is please bend your arm. There you go. Here is her tricep. And what I do, just hang it loose. There we go. And lightly touch. And as you can see, it moves. Very good. And I'm going to test her. Put your foot down, honey. Her left lower extremity. And I will hold up her leg. And that is within normal limits. Also, I have a reaction. Both her tricep and her patellar reflex are both +2, which is in normal limits. Morgan, what I need you to do now is follow my instructions. Put your hands one up, one down. Flip them rapidly. Very good. Can you do this? Very good. Reflexes within. I have asked Morgan to lay down so that I can assess her abdomen. I'm going to pull your shirt slightly up, Morgan. There is an observable piercing on her belly button. I'm going to listen to her bowel sounds. I'm guessing you're hungry, Morgan.
Mm-hmm.
Yep.
Just got home from work.
Bowel sounds are present in all 4 quadrants. Morgan, I'm now going to palpate your abdomen. Does that hurt?
No.
Is there any discomfort at all?
No.
Let me know if it's uncomfortable.
No.
Okay, I'm going to go just a little deeper. Any pain?
No.
Let me know if you have any discomfort whatsoever. Any discomfort at all?
No.
Wonderful. We have completed the head-to-toe assessment, and I have found no abnormal findings at this time. I have spoken to Morgan for a few minutes privately. I have washed my hands again.
Yes.
And this concludes the assessment for the head to toe. Thank you.